How is cholera transmitted in Japan? Cholera is an important imported infectious disease, but it can also be contracted within Japan. The number of cholera patients contracted within Japan has decreased compared to the past, and medical professionals are less interested in cholera contracted within Japan. This time, we experienced cholera in a socially vulnerable person, a homeless person. It is important to be aware that there are still cases of cholera contracted and developing within Japan. Mr. A had been experiencing discomfort in the lower abdomen since around June 29, 2001, and had watery stools 4 to 5 times a day, vomiting, and abdominal pain. He was admitted to Hospital A due to dehydration. His blood test showed a CRP level of 11.1 milligrams per deciliter, and he was given fluid replacement therapy. Vibrio cholerae, O1 L-tor inaba, was detected in his stool. It was later confirmed that the above Vibrio cholerae has the ability to produce cholera toxin. His condition improved smoothly, and he was discharged on July 14th. He had no history of traveling abroad. Mr. B had frequent diarrhea, and stool culture was performed. V. cholerae O1 L-tor Ogawa was detected, and he was transferred to Yokohama Municipal Hospital. Cholera toxin production was positive. His consciousness level was JCS 1-3. His body temperature was 36 degrees Celsius. His blood pressure was in the 90s, and he was taken off the ventilator. He had pre-renal acute renal failure due to dehydration caused by diarrhea. Although he was given large amounts of fluid replacement, his BUN and CRN increased, so he underwent dialysis a total of 6 times with the above diagnosis. He then entered the diuretic phase, and his renal function recovered. His impaired consciousness at the time of admission was presumed to be due to dehydration and shock, but delirium continued even after his overall condition improved. His condition before admission is unknown, but he now suffers from dementia and is considered unable to live alone, so he was transferred to a nursing facility. The above patient had no history of overseas travel and is presumed to have been infected within Japan. He was homeless. He lived near the Sumida River and sometimes ate meals together. He apparently used water from a disabled toilet in a park for daily cooking and other household needs. He also apparently sometimes cooked and ate turtles caught in the Sumida River with several other people. The route of infection is unclear, but it is presumed that this living situation was related to the infection. He was found collapsed on the street and was fitted with an artificial ventilator. He underwent dialysis for acute renal failure and developed dementia while undergoing treatment. It was not possible to gather any information prior to the onset of the disease, but it is suspected that he was infected through his living environment. A bacterial culture test of the stool was performed at the hospital where the patient was first admitted, which led directly to the diagnosis of cholera. If the bacterial culture test had not been performed, cholera would not have been diagnosed. In Japan, even if a patient with diarrhea visits the hospital, if the patient does not have moderate to severe diarrhea, they are often diagnosed with a cold or viral gastroenteritis and are given antibiotics without a bacterial culture test of the stool. It is likely that some cases of cholera are overlooked because stool cultures are not performed. Cholera can occur as a food poisoning, and 4 cases involving 19 people were reported between 2000 and 2004. In Japan, where the proportion of imported food is high, there is a risk of infection with cholera through imported food ingredients. When a patient with diarrhea not related to overseas travel visits the hospital, it is advisable to perform a bacterial culture of the stool, as with overseas travelers, and medical personnel should be aware that cholera can be transmitted within Japan. We will also introduce diseases that are increasing in Japan. Diabetes. The number of diabetes patients in Japan is rapidly increasing due to changes in lifestyle and social environment. Once diabetes develops, it cannot be cured, and if left untreated, it can cause complications such as retinopathy, nephropathy, and neuropathy, which can lead to blindness or the need for dialysis in the final stages. In addition, diabetes is known to promote the onset and progression of cardiovascular diseases such as stroke and ischemic heart disease. Key measures to combat this disease include prevention of onset, early detection, and prevention of complications. According to a study of Japanese immigrants, it is known that among Japanese immigrants in the United States who have the same genetic background as Japanese people but have more westernized lifestyles, the prevalence and incidence of diabetes are both 2 to 3 times higher than among the Japanese population. Obesity is a state in which adipose tissue accumulates excessively. When a person becomes obese, they are more likely to develop various diseases, such as metabolic disorders such as diabetes, hypertension, and dyslipidemia, menstrual disorders, fatty liver, sleep apnea syndrome, and osteoarthritis. When a person has health disorders caused by or related to obesity, or when such health disorders are predicted, they are considered to be in a state in which treatment, i.e., weight loss, is required. And in Japan, they are required to be treated as a disease entity known as obesity. Cancer, looking at the number of cancer deaths by site in 2022 by cause of death, the top 3 are lung cancer for men and colorectal cancer for women. The number of cancer cases is increasing for both men and women for pancreatic cancer, while liver cancer is on the decline for both men and women. Looking at the number of cancer cases in 2020, prostate cancer is the most common cancer for men, and breast cancer is the most common cancer for women.